Coming up on Mayo Clinic Q&A.
The amount of stressors and different uncertainties that we've been going through. So as that wear and tear gets to us, and if there hasn't been an opportunity to do some more restorative things, then after a while we do become more fatigued.
The lingering COVID-19 pandemic is not only causing fatigue, but it's also contributing to stress and anger. Today on Mayo Clinic Q&A, we'll discuss our mental health and get some tips to minimize the effects of pandemic-related stress.
Because there's probably a whole host of things that we're getting really angry and frustrated about that are really based upon things that we don't have much control over. Maybe we can put aside some of the parts that we don't have as much control over and try to use that anger in a motivational way, because anger is an upregulating emotional state. Can we funnel that anger towards doing something that may be more productive or may be able to help us out a little bit more?
Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. The Delta surge is just the latest wave in the ongoing COVID-19 pandemic. For healthcare and frontline workers, there's fatigue due to stress, fear, and sadness about ongoing disease and death that they see every day. But this is taking a toll on all of us. For over 18 months now, we've all lived under a heightened level of stress with COVID-19, and it's taking its toll. Nearly 4 in 10 Americans have reported that worry and stress related to COVID-19 has played a negative role in their mental health. So how can we better cope with this and deal with our feelings? Well, here with us to discuss today is Dr. Craig Sawchuk. Dr. Sawchuk is a Mayo Clinic psychologist. He's the division chair of integrated behavioral health. Thanks for being here today, Craig.
Great. Thanks for having me back, Dr. Gazelka.
Well, I love to have you here, Craig, because you're a boots on the ground guy. You're not just a guy who works in research. You are seeing patients in the clinic day in and day out, and I'm sure are familiar with the stress that COVID-19 is taking.
Yeah, without a doubt, it's really is a blessing to be on the front lines with our colleagues in primary care, family medicine, and pediatrics. And under normal circumstances, that's the first place that people go to for their health care, mental health included. But certainly over the course of the pandemic, we have been seeing everything that our patients and also our staff have been going through on a day in and day out basis across the entire pandemic.
Yeah, I do love, it's a discussion for another day, but I love the concept of you being integrated into the primary care clinics. I think that's fantastic.
Yeah, it's the best way to deliver mental health care these days. And there's certainly no shortage of mental health things that we're able to do to help folks out now.
Oh, that's great. Craig, tell us a little bit about compassion fatigue. What is meant by that and what are people experiencing?
Well, you think about it not only from a healthcare perspective or a healthcare professional perspective, but just a human perspective. Being compassionate and empathetic is just part of the normal human experience. And whether it be that you're caregiving for folks in your own life, being just a supportive, colleague or a friend, or just even the reasons why, folks get into healthcare in the first place, just being empathetic and compassionate helps us to connect and to be helpful. But at what point does it become too much of a good thing? We think of just the wear and tear that the pandemic has had on all of us. We kind of think about it almost like an erosion effect over time with the amount of stressors and different uncertainties that we've been going through. So as that wear and tear gets to us, and if there hasn't been an opportunity to do some more restorative things, then after a while we do become more fatigued. So this is where people may start to get a little bit more edgy, a little bit more irritable, a little less patient. And of course that can happen on a continuum as well.
Why do you think people are becoming more edgy and even, I would say angry at sometimes in some of the things that I see on social media, for instance?
Well, the latest catchphrase is panger. How our kids used to talk about
I didn't hear that one yet.
Yeah, well, as our kids used to talk about being hangry,
Yes.
being irritable when they're hungry. Well, now it's kind of irritable with the pandemic. So panger is what we're seeing. And honestly, the anger is just coming from so many different angles. And again, it's been going on for a long time. So we can think about just frustration with wanting to get our lives back. We're just hoping for the end of the pandemic so we can get back into doing the things we'd ordinarily do, the things that we've been cut off from over time. Then we can think about just frustration that we can have with people that we feel are not doing their part to manage a pandemic, whether it be pushing back on vaccines, not social distancing or masking or doing other things like that. And then reverse on people who are just angry because they feel like their rights are being infringed upon because of these different mandates that are put into place. And then you also take this backdrop of other stressors that have been happening to us that also evoke anger, civil unrest and some of the political things that have been happening. So it's just been a lot of anger all coming together kind of at the same time.
So how can we fight that, Craig? How can we encourage the development of empathy in ourselves and in others?
Well, I wish it was as easy as it is would be to say, well, just stop being angry. Just relax. It's not that easy. It's a lot easier said than done. I think number one thing is we have to acknowledge the anger. Anger is a normal human emotion, and there are lots of things to be angry about these days. So we just got to be honest with ourselves that just because we're feeling that anger, feeling that frustration, we don't want to overly pathologize it. Now, again, it can be too much of a good thing, but there's a couple of strategies beyond acknowledging that that you want to pay attention to. The first one is actually recognizing that as emotions get cranked up, that flexibility in our thinking and our ability to problem solve actually goes down. This is true for all emotions, anger included. And unfortunately, we can all point to experiences in our own lives where, yeah, anger's kind of gotten the best of us. And then after the fact, we're thinking, oh, that probably didn't come off, the right way, or it's gotten us into trouble in some ways. So one of the first tips, beyond acknowledging that anger, is to even do some brief relaxation related exercises. These are among the most easily done portable types of skills that we can have out there. But what it does is it helps to give us more flexibility in our ability to think and to problem solve. So doing relaxation is one. Second is part of our mindset as well too. And that's really where acceptance comes into play, because there's probably a whole host of things that we're getting really angry and frustrated about that are really based upon things that we don't have much control over. So if we can acknowledge, well, what parts of this equation can I have control over and what parts do I not? Maybe we can put aside some of the parts that we don't have as much control over and try to use that anger in a motivational way, because anger is an upregulating emotional state. Can we funnel that anger towards doing something that may be more productive or may be able to help us out a little bit more?
Craig, one of the little practices that I have in my life that I think has helped me is that I try to practice gratefulness on the way to work in the morning. So I have about a 15-minute drive into Mayo Clinic in the morning. And so I try while I'm driving in the car to list things. I'm alone, so I can do it out loud, that I'm grateful for. And I try not to make it be the same things every single day. But I think that helps put me in a better frame of mind as I'm facing the day.
That's another great strategy that you identify there, because it's very portable and it's really helpful for us, because if we think of how the brain works, the brain is just naturally hardwired for threat. So we're much more likely to pay attention to that threat. And again, there's threat everywhere these days. So we actually have to help our brain to kind of balance it out and refocus a little bit, and doing very deliberate practiced gratefulness, exactly like how you're describing it, and kind of weaving it into already part of the daily routine, is a wonderful way to kind of get your mind in that better mindset. And kind of depending upon the morning and where you're at, sometimes maybe taking a scenic route into work and maybe giving yourself 20 minutes or 25 minutes to get in, might be helpful as well too.
I might need a little more time for my gratefulness.
Exactly.
Craig, I've been curious about the toll that the pandemic has taken on mental health in the United States. I have often wondered if there will be some incredible fallout from this in some way. Is there more anxiety and depression due to the pandemic?
Yeah, we initially saw this anecdotally, but clinically, and now the research is really backing it up as time is going along. The studies are now starting to come out that are just tracking what's the pulse of mental health
Mhm.
symptoms that people have been reporting across time in the pandemic. And one of the largest studies that have come out over the course of the pandemic has looked at reports of symptoms of anxiety, depression, even trauma, and insomnia are up anywhere between 2 to 4 times higher over the course of the pandemic as it was at the same time, kind of pre-pandemic. So we're seeing, this big surge, and it totally, again, it totally makes sense when you think about the human experience of dealing with these stressors, the uncertainty, the job instability, economic fallout, as you mentioned, and all these other things, not being able to do the things we'd ordinarily enjoy doing or blow off steam. A lot of that is leading to just that increased pressure. And you really see not only people that historically have struggled with some mental health related difficulties, but we're also seeing people that maybe have had stressors in life, but maybe not to the point where it's gone into the direction where they've been experiencing more breakthrough mental health symptoms. We're seeing a lot of that as well too.
Craig, do you think people are more willing to seek help for mental health issues now? And how should an individual know if they need to seek help?
Yeah, it's been, in a weird sort of way, it's been one of the silver linings of the pandemic. Again, I
I
say
love
that,
silver
and
linings.
yeah, we need silver linings as part of the things that we're grateful for. But did we ever want a pandemic? Of course not. But one of the big things that's come out over the course of the pandemic is just an awareness of the toll and the
Mm.
mental health toll that this is having on us. So in turn, we've seen a lot more public health messaging about the importance of looking at your mental health as health. We've also seen a lot of clinics and other hospital, programs really investing more in their mental health services. Companies increasing, their insurance to be able to help support people with mental health. We've seen transitions in the delivery of mental health services by going from in person to now doing virtual, both individual and groups. So these are some really good things that have come out of it. Certainly when you're finding things like worry and stress and even your mood going down to the point where it's really causing problems in your day-to-day living, being able to keep up with things, whether it be at work or at home, or even withdrawing more socially, much beyond what we're recommending from a public health, perspective these days, that would be important, to check out. And always one of my favorite places, and I know I'm biased with this, but one of my favorite places to check out first is to talk with your primary care team.
Mhm.
They know you, they know your health care, they also know what resources are available, and they can help you with focusing your search on finding what might be the best mental health resource or resources for you.
Craig, I'm going to switch us a little bit to the holidays because they're looming large. We're getting very close to October right now. As we get to the holidays, is it okay for family members to discuss their vaccination status and to make decisions for the holidays based on that?
Yeah, when you take a step back, is we're still in a public health crisis, and when we think about the nature of COVID, where it's a publicly transmittable, condition, and the consequences of that can be, quite terrible. It totally makes sense, to be able to have this as a focus of conversation in your planning beforehand. And chances are we're this deep into the pandemic that families already have been having these conversations, sometimes arguments, about where they stand, on the pandemic. But when we think about, like, under normal circumstances, under non-pandemic times, when we get together with our families during the holidays and traditions, well, what does it look like? We're all kind of crowded in a small area. It's probably not ventilated, the best. We're hanging out. There's lots of contact and touching. We're sharing food and other things. I mean, and that's great. And that's how holidays should be spent. But if we think about that in the context of a pandemic, right now, that's really hard to navigate, and especially folks that may not be vaccinated, during that time. And that's where I think it's very, very appropriate that people do hold those conversations so they can think about the planning for that.
How do you say that nicely if you feel you shouldn't participate? How can individuals share that and be as least offensive as possible, I think.
Yeah, and this is where we always want to think about both the message and the delivery of it, but we'll take a step back. And I think what's important to is pay attention to your own values. What's important to you? Is it important for you to maintain safety and health of not only yourself, but of your family as well too? And if that's a primary value, that should be a good motivator to hold, these conversations when we're worried about getting into a situation, or maybe even pressured or guilted into getting into a situation that objectively is higher risk. So it's important that when we're planning on having a conversation like this, is that we're doing it in accordance with our own personal values. Now, it's also important to know that this isn't going to be a debate. The last thing that anybody needs to do is get drawn into a debate to defend, their position on things. So you can always couch it in a way that I love you and I want to be there, or a family wants to be there. But given where we're at right now in the pandemic, we're unfortunately going to have to take a pass on it this year. Likewise, you can also look at, well, what are some maybe alternate options that can be found? Is there any kind of middle ground, and being open to that, whether it be doing some of this virtually, or maybe during a time when there's not as many folks getting together with a smaller group who are more vaccinated? Or can you do the drive-by Thanksgiving where you chat out on the driveway where it's more ventilated and other things? So there are some flexibility in ways maybe that we can approach it, but trying to approach the situation with sensitivity and compassion. But remember, it's not a debate. If it's consistent with your values that this is what you need to do, then just couch it in that manner.
Thank you for that, Craig. That's always difficult, and I think the pandemic has, in some ways, made it really polarized things a bit for folks.
Right, and we're craving so much to get back together again.
Yes,
so
yes, exactly.
As the calendar comes right back around again, it's like we're dealing with this stuff in 2020, and we thought for sure by 2021 it was going to be the best Thanksgiving and the best Christmas ever. And now we're looking down the barrel of, okay, well, we've kind of had some practice, with this. So again, it's acknowledging that it's been really, really tough, and we desperately want to get back together. But the best way that will get us out of this pandemic is if we continue to take all those good public health measures.
Thank you so much, Craig. Any last words of wisdom for our listeners today?
Yeah, just continuing to stay optimistic about things. I know things are going to get better. They will. And we've made already tremendous progress when we consider where we actually were at this time last year. We now have, vaccines, or therapeutics are getting better. The boosters are here and almost here for other parts of the population as well too. So we'll eventually get to the other side of this. We just got to continue to work on our own patients and continuing to treat other people, with patience and kindness as well.
Oh, I like that. And I love that you mentioned silver linings about COVID. I love to think about the silver linings because I think it's part of that remaining optimistic.
Well, you got 15 minutes at the start of every day on your drive in to focus in on the silver linings. Just make sure you're also paying attention to the road while you're driving in too.
Thank you so much for being here today, Craig.
Great. Thanks for having me.
Our thanks to Mayo Clinic psychologist, Dr. Craig Sawchuk, for being here today to talk to us about COVID-19 and mental health. I hope that you learned something. I know that I did. We wish each of you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.